Have questions about your health? Well, the doctor is in. Dr. Janet Seabrook, Community Health Net CEO and all-around health expert. Dr. Seabrook wants to help because your health matters.
All right, and good afternoon. Well, almost in a couple minutes. So we're going to have some conversation with Dr. Seabrook right now, and we're going to find out about what matters about your health with Community Health Net. Good afternoon, madam.
Good afternoon, Natalie. Thank you so much for being so accommodating today.
Can I put our disclaimer out there, and then you can just dive right in. The views expressed by the hosts and callers of this show are not necessarily views of WLTH Radio Management, owner, and sponsors. And with that, I want to kind of segue into this conversation because this is coming up as National Immunization Month. And we know, as you mentioned, back to school physicals and different things, and make sure we get those shot records done. The question is there's been a lot of opposition lately in terms of getting your children immunized. Can we talk a little bit about that?
And that's really why I was so persistent on coming today, even though I know I was late and throwing everybody off. I really wanted to have this conversation because the Cervical Cancer Center, they're out of Indianapolis, was here on Monday this week at Methodist to have a focus group with several area physicians, and Community Health Net got to participate in that focus group. And what we found out is that Lake County has some of the lowest numbers of immunizations in the state. And so what Cervical Cancer Center really just wanted to have a conversation with us about how we encourage our patients and their families to get their children immunized. And really, the conversation is not about those vaccines that children have to go to school, because children are getting those. The problem is there is a vaccine that can prevent cervical cancer. It is now being counted as a immunization for children to have starting at 11 or 12 years old up until age 26. But it's optional, and that's the issue. Even though it's considered optional, it's still counted through the state as something that needs to be done. And what is happening is that is bringing our rates down for immunizations because it's being counted in that number. Parents don't have to give it to their children. And what happened is the HPV or human papillomavirus vaccine got a bad rap when it first came out a few years ago. And it came out and it was just for girls. And then research has shown that boys are the carrier of HPV, so it would make sense to give boys the immunization as well. Cervical cancer is a serious cancer, but it is a treatable cancer. It's a treatable cancer if it's caught in time, but it's a preventable cancer if children starting at age 11 or 12 get this vaccine, and they can get it up until age 26. It isn't as effective after age 26, particularly if the person has been sexually active. They may have already been infected with the human papillomavirus. But the human papillomavirus causes cervical cancer in females, and males are the carrier of it. And so, like I said, it makes sense for males to get the vaccine as well as females. So right now, it's just about educating the population. And you have with any type of medication or vaccine, you have to list out, and even a treatment, you have to list out the risks versus the benefit of that treatment or vaccine or medication. And typically, if you're going to use something in the public realm for modern treatment, you're going to look at those benefits outweighing the risk of what may occur. Because with anything right now, even if aspirin were to go back through the FDA and try and get approved, it would have a problem because the long list of side effects that aspirin can do to certain people in the population. But you wouldn't want to not produce aspirin anymore because of all of the good benefits that it has, one of which is helping to prevent heart attacks and strokes. And so helping to keep the blood thin for people who are prone to having heart attacks or strokes. So you have to look at the risk versus benefit when you're looking at any type of medication or treatment option or vaccine for the population. And unfortunately, you will have a small group of people who may be affected adversely with a medication, a treatment, or a vaccine, which is why they're reportable to the state and also to the federal government. And if you have a large amount, a large percentage, then of course that's when things are pulled off the market and things like that. That's the only way that we know that then the risk outweigh the benefits of having that medication or vaccine or treatment on the market, and then it's pulled. So some things have been pulled. I'll give you one. It used to be, and this was long ago, it was called thalidomide. It was a pill that women were given while they were pregnant for nausea. It helped to treat nausea. But when the babies were born, they had no arms or legs. And so thalidomide, after however many, women had this incident happen to them, thalidomide was pulled off the market and is considered a black box medication. And we don't give that medication anymore. Now I went back to the 1960s and early 70s. But as you can see, you very rarely see, and they were called the flipper children because their hands, they had very short arms and very short, they had hardly any legs, and they had feet and arms, feet and hands, and that was it. So they pulled that medication off the market. So when things happen like that in large numbers, then of course you're going to have that pullback of that medication. And so I guess the point I'm trying to make is with the human papillomavirus vaccine, you've had a small amount of people who have had a reaction to the medication, but not in large enough numbers to warrant pulling the medication off the market. And not only that, the benefits of being able to prevent cervical cancer outweigh the risk of the medicine being on the market. And that percentage of people who have had adverse outcomes has declined since the medication came out almost 7 to 10 years ago.
Oh, so that was my question. I was going to ask you about the effects outweighing the benefits. Now, is there, when they get the vaccination for that particular one, is it done in 2 series? Do they have to get one now and then they get one later?
Yes.
Okay. Okay. Does it make a difference what age? As long as you said, as long as by age 26 that they get it.
You should try to get the series in as it's prescribed. If you're starting the series at usually 11 or 12, preteen is where we want to start. Hopefully before anybody's sexually active. But then up until age 26, you can get it. But you want to get it in that 6-month to 12-month period. When you get the first one, you want to get the next one. Within that period, you don't want to stretch it out years in between, if that makes any sense.
So since the males are the carriers, I mean, they could just consistently be carrying it, no effects, no anything?
Right.
Okay. And then it's going to affect the female once you... Wow.
Yes.
Wow.
So I think that one of the things that came out of the focus group on Monday is we believe, and this was some of the physicians, believe that because of the connotations of human papillomavirus is only transmitted by sexual activity. So you have the concern, I'm sure some parents do, that by giving this vaccine that you're giving your child approval to have sex. No, you can't look at it like that. You're protecting your child for the future. What some of the doctors, especially a couple of the pediatricians that were there, how they were able to convince their patients and their parents to get the vaccine is to include their story and to make it personal. And we had pediatricians there and other doctors there who have teenage children who, got personal, and they tell their patients, if I had children this age, or if this vaccine was available when my children were that age, I would have gotten it. Because we had one physician whose children are in their 30s, and she said if this was available, I would have gotten it for my child, my son and my daughter, when they were, teenagers, if it was available at that time. And we had doctors who currently have children in that age range that said that they had gotten the immunization for their children, and they tell their patients, I would not tell you anything that I have not done for my own family members. And so those physicians and nurse practitioners and other providers said that when they personalized their story, they had a better outcome with getting the parents to go ahead and approve that their child having that vaccine.
Wow, that's amazing. I'd like to talk to Dr. Seabrook regarding the information she just gave. You can call us. She'll be here for a few minutes longer, 219-885-1371. That I heard about that probably about 10 years ago, and it was just startling. I mean, it's something you never thought about, or even thought about the male carriers and the female in terms of receiving the actual germ themselves and coming up with that. But it's amazing how, as you talked about, medication has advanced and we're progressing forward in terms of prevention.
And like I said, people really don't want to talk about it because of what it connotates and what it means. But the virus that causes cervical cancer has also been found in cancers of the neck, the head and neck.
Wow.
Because of activities that some teenagers do to not be sexually active, so to speak. And so that is causing some people to have cancers of the throat and the neck. And we've been seeing an increased amount in people in their 30s and 40s.
Wow.
That don't smoke.
Wow.
Yeah.
You just never think about things that way.
You don't. And so if we want to protect our children for the future and protect future generations, we need to consider having them vaccinated for the human papillomavirus. I know the immunization schedule has gotten out of control. There are a lot of vaccines. It used to be by age 11 or 12 you were done with vaccines. And then all you had to do was worry about if you play sports, you know, getting your physical for sports. But now we have vaccines that are starting at, 11 and 12 because we want to protect them from also meningitis when they go off to college. So we want to make sure that they have the meningitis vaccine as well. And then there are some.
So does that completely prevent it? It was like, because when I was coming up, meningitis was not one of the considerations.
Yeah.
Okay.
So what we've been having are outbreaks of meningitis throughout the country, and typically they're where people are clustered together, college dorms and things like that. And so the vaccine now we're giving it at a later age. Between 15 and 18 to make sure that those kids that are going off to college and congregating together have that vaccine and they're protected from meningitis.
So isn't there a viral form and a bacterial form of meningitis, and does the vaccination prevent it?
The vaccine prevents the viral.
The viral. Okay. Okay. Wow. Interesting.
Yeah. So it's just, there are so many things out there. It's important to be educated, but then it's also important to talk with your provider one-on-one and just, ask the questions that you need to have answered so you can protect your child.
Okay. Well, it's amazing and it's interesting, as you're saying, that they're coming up with different things to attack different problems that, number one, we didn't think about before. So that's why the importance of getting the vaccine to help in terms of the prevention. Okay. Wow. So let's talk about the others, because I know there was a recent outbreak of measles.
Yes.
Okay.
Yeah, and that was something that you really never heard of, but you have families, parents that are objecting to receiving the measles vaccine. And so unfortunately when that happens, then you place other people at risk, young children, pregnant mothers, and picking up the measles vaccine. So it's really unfortunate that people are objecting to that, but we've been having, probably since I was in residency training, and that was back in 1996, 97, when there was a serious outbreak in Illinois, in the Chicago area, and we had a smattering of cases. We had about 5 or 6 cases in Gary, but the majority of them were in Chicago. But we have that people traveling back and forth between Gary and Chicago, so we had a small outbreak here in the Gary area back in, I believe it was 1996 or 97, and more than likely it was children who had not received their vaccine yet that had come in contact with people who had measles who had never had the vaccine, and parents had refused to get them the vaccine. I think that you see fewer and fewer of those outbreaks because more parents are being educated. There was this big fear about the measles vaccine a few years ago. It did have the thimerosal, which was mercury in it. That was removed, just like we removed the mercury thermometers. You don't see thermometers with mercury in it anymore unless you go over somebody's great-grandmother's house or something like that. They all should have been turned back into the hospitals, or don't throw them in the trash if you do have one, because it has mercury in it. Take it to your doctor's office and let them try and figure out what to do with it. But we got rid of mercury, and there's this facet or group of people that believe, they have an idea, they believe that the vaccine, the measles vaccine, causes autism. There have been extensive studies to disprove that. I just think, and this is Dr. Seabrook's personal opinion, we're getting better at diagnosing autism. That's what I believe. I believe that before we were able to get down to like really fine tune and look at things, everybody was lumped in one category as mildly, moderately, or severely mentally challenged or mentally handicapped. And now that we have a better sense of autism, Asperger's syndrome, and those type of spectrum disorders, I think that that's why you're seeing so many people having a diagnosis, because now we're able to better pinpoint what is going on. And this is again my personal opinion. I do not believe that autism and the measles vaccine are tied together. I gave my children the measles vaccine, and I had no qualms about it at all.
Okay. Well, there are a lot of people, they get this eco idea and eco-friendly stuff that they're thinking about, and you hear them say, well, you're actually giving my child the disease, and what happens if they can't. And you know, people, haven't you heard people say that that's the disease? I mean, even with like polio, they say that when I got a polio shot, that was one of the things that said that they were really giving me polio. And my grandmother cried for 2 days because she hated that she had given me that.
So we have some live vaccines. Polio is a live vaccine, and then you have an inactive polio vaccine. And typically in pregnant women and small children, we give the inactive polio vaccine. And we rarely use the live polio vaccine now. It's rarely used.
Now, if a person does not get it, let's say going through all those childhood years, does it make sense as an adult? Because, you know, no matter how old you get, you can get the chicken pox. Mm-hmm. So does it make sense that at some point in life just to go back and start getting your vaccine?
I would talk with your healthcare provider,
okay.
Because some of the vaccines are for adults. You can also have those. So I would speak with your healthcare provider to really, because like now it's a big push for making sure that adults have the whooping cough or the diphtheria vaccine, because they're making children vulnerable, and it can kill a child. The whooping cough can kill an infant. You've seen the commercial where the grandmother is really nice and she's holding a newborn baby, but she turns into the big bad wolf because she has whooping cough. She has diphtheria. So it's very important. There are some, like I said, there are some vaccines like the tetanus and diphtheria vaccine that you can get as an adult. That will help protect you and your grandchildren.
So does that mean also that we can't assume that because you don't hear a lot of people coming up with these diseases that they're gone and we don't have to worry about any of that anymore?
Like smallpox, we eradicated. The government eradicated, the World Health Organization eradicated smallpox years ago. However, because we live in a society now where we're just an airplane ride away, or other people are just a ride away, an airplane ride away, and their laws and their restrictions and their vaccinations may not be as stringent as ours, so they may come and not have the same vaccines that we've had, and that sometimes causes little pockets or outbreaks. Last year or year before last, there was a huge measles outbreak in Minnesota, because many of the Somali Somali immigrants that were placed there in Minnesota a couple of groups got to them and were talking to them about not getting the measles vaccine because of the scare with autism. So you had a small group of them decide not to get the measles vaccine, and then there was a huge measles outbreak in that community. So it's very important that you speak with a professional about your decision to vaccinate or not to vaccinate.
219-885-1371. If you have a quick question for Dr. Seabrook, our time is winding down, and we're talking about immunizations. Now, here's the thing that's kind of tricky. As old as I am, there are times, I think at Passport or something like that, someone asked me about my immunizations. And I remember we used to have this folded up little piece of paper that we kept, and it like stayed and it transferred, and at one point you couldn't read anything off of that. Say I'm a parent and I'm coming and I don't have that record when I come to the stadium. What am I supposed to do?
So unfortunately, if you don't have your child's shot record, we're not going to be able to give because we don't know what they need.
Okay.
Now, fortunately, our state, I don't know about other states, has the CHIRPS program, which is the Children's Health Immunization Registration Program. So our health center and other doctors' offices across the state that participate in this registry, when we give a child a vaccine, we put their name, their date of birth in there, and the vaccines that we gave. So it actually, when you can ask for it to be printed out, and it actually looks like a little card like that you referred to. And so there is that, but it's not necessarily available every place that you go. So we're not going to be going into the registry at Railcat Stadium. We're going to be asking you to bring the shot record with you so we can give what's needed and update that. And then when we get back to the office, we'll put it into the registry.
So is there anything that I can come with other than, I'm trying to remember that they had it, and I think they did because they got this big whip on their arm. And
You
had a
need to
fever.
contact the doctor
Okay.
and get a copy of the shot record. The doctor that gave the vaccine legally has to keep a record of that.
Okay, all right, let's go to the phone lines. Good afternoon, caller Young, Dr. Seabrook. This is WLTH AM 1370, Gary, Indiana, and this is a different edition. We're having a conversation with Dr. Seabrook because August is National Immunization Month, and they have several activities that are coming up, particularly one big event. And as your children go back to school, she's giving us some very good information.
Railcat Stadium, August 11th, 9 to 2 p.m. Like I said, the City of Gary and Community Health Net are in partnership to put on this citywide back-to-school event. There will be backpacks, school and sports physicals will be given, vaccinations by the City of Gary Health Department, food, prizes, just a lot of fun for Saturday, August 11th, 9 to 2 p.m.
And will they be giving the human papilloma vaccination there that day as well?
It will be available.
Okay.
Mm-hmm. All of the state vaccines will be available.
Okay. So you talked about it because it's been a long time since they started out on the whole regimen. But remember, you had to have something between 1 and 3 months, 2 and 6 months, and that is not the case, or there has been more added to it.
That is more added to it. So those standard vaccines that you just talked about, with the first one being in the hospital, which is the hepatitis B vaccine, that still stands. You get that in the hospital on day 2 of your life. And then after that is 2 months, 4 months, 6 months. That schedule, 12 months, 18 months, that schedule still applies. But up until between 4 to 6, you get your last set, and then you go off to school, kindergarten or first grade. And then there are series throughout until you're 10 or 11 years old. And that used to be it. You were done. But now we've added more in your teenage years, which is what's throwing everybody off.
Here's one that I remember being required to do, and I want to know what about that one, and that had to do with tuberculosis. You always had to get this.
Now that's a TB test.
Okay.
That's a test.
Okay.
Yeah. So we still so there are some places, daycares and places like that, jobs, particularly if you work in a healthcare environment, that require a TB test. And that again is just a small amount of tuberculin put under your arm, and put under the skin of your arm, on your forearm, and then it's measured in 2 days. And if you've had a reaction to it, then we need to do further studies to see if you have been infected with TB, and that you get a chest x-ray. But typically, we don't need to go past that step because most people don't have TB.
Okay. Well, that's a great thing. I remember those days, and they were not fun.
No, they were not. And actually, I'm glad you brought that up. Community Health Net is the lead agency for TB in Lake County. So the TB nurse is actually housed at our location, and she does go into the community. She's notified by the hospital when there are cases in the area. We don't have a lot of cases in the area, but do know that we are being protected. The nurse goes to them in their homes and observes them taking their medications, because what we don't want to happen is if you miss that medication and you don't take it, or you don't have access to it, you can have resistant TB, which can not only be life-threatening for you, but also people within your household. And so just know that Lake County has a very competent TB nurse. She works at Community Health Net, and she goes out in the community, and those people who do have a TB or latent TB, they are being treated very competently with a qualified TB nurse that is highly recommended, and we're glad to be the lead agency for TB in the community.
Your help matters to community health. That's awesome. That's awesome. Well, we certainly want to thank you for spending this time, because it's very important. The conversation that we just had is just something people take for granted every day, or maybe they didn't even know it. You know, that's another thing.
I think that people don't realize the importance of vaccines, because it's almost like an everyday thing now when you go to the doctor's office. And so to hear about those in a different light and what they actually prevent, and the outbreaks that they're prevented by getting those vaccines. I don't think people understand the relevance of vaccines and what they actually prevent in the community, because if we did not have those, people would be dying of very deadly diseases. Vaccines prevent deadly infectious diseases in the community. When you don't get those, you put yourself and the community at risk for those diseases.
Wow, that's interesting that you would say that, because I was having that conversation this morning. Is the way a lot of stuff get miscued is because you listen to information from other people, and those are the myths that we put out there and that you don't know, and it gives you less of an understanding, and that you're more likely not to even want to deal with it because you heard this or that myth. So
I always refer people back to their healthcare provider. Always.
Okay.
Yeah.
Well, that's a good thing. That's really a good thing. So we certainly want to thank you for spending this time.
Well, thank you again, Natalie, for being so patient with me today.
Well, I appreciate you coming.
You are a saint. You are an angel. Thank you so much.
Well, thank you. I really appreciate you coming, and just to let you know that it was important. It's very, very important that we stay on top of our health, because we keep talking about that wheel and all of those things, and we got to keep people healthy. We got to do better about that.
Yes, we do.
All right. So with that, I'm going to turn you back over to automation until the 2 to 5 drive with Tommy and Latrice. But everybody enjoy. Really want to thank, I just can't appreciate Dr. Seabrook and Community Health Net enough for giving us this information about how our health matters. And it's a community. You talk about that all the time. It's a community. So thank you so much. But everyone, have a great day. WLTH AM 1370 in Gary, Indiana. And we're also broadcasting, simulcasting live 92.7. So listen to us on the FM side as well. Everyone have a great day.
Have questions about your health? Well, the doctor is in. Join Community Health Net CEO and all-around health expert, Dr. Janet Seabrook, every fourth Wednesday on WLTH 1370 AM. Don't be shy. Call in and ask your questions. Dr. Seabrook wants to help, because your health matters.